Okay, next we're gonna do the Caldwell. So you can get a Caldwell for facial bones or you can get a Caldwell for sinuses. If we do a Caldwell for facial bones, we're gonna utilize that 15-degree caudal tube tilt, making the OML perpendicular to the IR. So we'll go ahead and start with that one. If you wanted to do this one on the table, you could do this on the table as well. So I'm gonna have Libby press her nose and her forehead against the IR for me. And then have her flexor extend in order to get that OML perpendicular. You want to exit it nasion for the Caldwell. I'm going to do a 15-degree caudal tube tilt. And then I already have my bucky where I want it to be. And then I'm just going to make sure Libby's nice and straight with no tilt or rotation. And say you can collimate to the outer margins. Be mindful when you collimate up and down. You want to make sure you're getting all of that mandible on there on the inferior portion. Measure GP. I have my left marker up there already. Okay, so this would be your Caldwell for facial bones. The next one we want to do would be our Caldwell for sinuses. So remember, for any sinus works, you cannot do a tube tilt because you need to be able to visualize those air fluid levels without distortion. I open my collimation back up to 10 by 12. Get my angle liner. So since we can't utilize a tube tilt, what we actually want to do is elevate the OML 15 degrees in order to mimic that 15-degree caudal tube tilt. A little trick I usually start with is if you have people have them press just the tip of their nose to the IR, that usually gets you in the roundabout area of 15 degrees elevation. The other thing that you can do, take your angle liner, you'll press it right up against the IR, and then you will angle this down and line this up right over where your OML is to make sure that you're at 15 degrees. So I need to have Libby actually kind of tip her head up a little bit. Perfect. So Libby's tip of her nose is touching that perfectly. I have her OML elevated 15 degrees. We're still gonna exit at nasion for this. Go ahead and bring my bucky up to this. And then you can do tight collimation for this. Okay, remember we need to get the maxillaries and we need to get the frontal. So be careful how far you come down as far as the frontal bone, and then keep in mind where your maxillary sinus is located. I'll move my marker into the light field. Make sure Libby is not tilted or rotated at all. And then marker, measure, GP, and ask your patient to hold still.